All right, well, with that, we're going to switch gears a little bit, and I'm going to talk to you a little bit about, if you can bring my slides up, balancing work with your health and your back. There are a lot of interventional cardiologists out there who just have big egos and like to talk about themselves. This is a personalized talk, and I'll be talking about myself, but hopefully not in that egotistical type of a way. So I'll start off by saying, isn't being an interventional cardiologist one of the greatest jobs in the world? I mean, let's face it, that's why you all are here, because it's a super cool thing to do. And in fact, there are times
that's what heroes do.
We feel like Thor, because we do this because that's what heroes do. I mean, what other job do you get to talk to patients and really fix them, as Sanjog said, get paid some of the salaries that Sahil talks about, and to do all the other things you want to do? I mean, it's a pretty awesome job. So 3 days ago, this was a case one of our fellows is here, Jiho did with me. This is a patient who has, left main disease, has a nasty, nasty, tortuous LAD with some calcium as well, and we were able to fix this. And the patient, I swear to you, literally said, I feel like a totally different person after this is done, because that LAD was very ischemic. And this is what the final result looked like. There was thinking to do. How are we going to stent the left main? What are we going to use atherectomy? Is it too tortuous? All the stuff that you're going to hear about at this course, we went through technically. But at the end, I was left with this guy who was just super thankful that we were able to help him. And it was awesome. That's why we go into interventional cardiology. What I'm here to tell you, though, about, again, in a personal way, is something that I really want you to pay attention to as fellows, because I didn't. And I would look at my attendings kind of walking around stooped over, and I didn't see it. It was literally like when I got a dog, I all of a sudden noticed there were dogs all over in the park. Until then, I really didn't notice there were dogs in the park. It's the same situation. Until it happens to you, you don't recognize what can happen with all the lead and everything we wear. So this is a survey, this is data. 60% or 2/3 of patients have musculoskeletal pain secondary to wearing lead or working in the lab. 60% have orthopedic injury, not just one, but more than one, experiencing lumbar spine injuries in 1/3 of patients. 1 in 5 have to limit their time in the lab. That equals limiting the salaries that Sai was talking about before as well, despite 80% doing some sort of prevention, and I'll ask you that as well. And then there's issues of cancer and radiation consistent with the general population. So I don't know if anybody had ever told me this, and this is part of the reason why it's in this session, but I kind of did know there was a little bit of stuff going on, but I didn't know how serious it was. So here's some anecdotes. These are real live people. Dean Kariakis, I used to remember when I was a fellow, he would give all the talks on clinical trials. The guy is like one of the smoothest, most erudite people you ever meet. He actually had a severe foot drop when he was 38 years old and had a discectomy. 2024, he started having a radiculopathy and was popping prednisone as a way to sort of relieve the swelling, and ultimately basically collapsed in the cath lab and was functionally paraplegic. He had urgent decompression, and he walks around with a walker, and he occasionally has had to cath himself with straight cath. This is one of the reasons why. So you see there's a fellow there. They have shielding. They have rampart shielding, but the fellow's leaning over, and with the flexion of what's going on in the spine, there's all kinds of crazy forces that your spine is experiencing when you're doing the procedures we do. I borrowed this slide from Ajar Kochar. Is there anyone here from the Brigham? Raise your hand if you're here from the Brigham. All right, so tell Ajar, thanks for the slides. We communicated a bunch, and I think he's done a lot in this area. He's a young guy who's really interested in it, so thank him on behalf of all of us. Here's anecdote 2. Kenny Rosenfield is actually announced as going to be winning the Master Operator Award at TCT. This is what his MRI looks like, and you see there's no discs anywhere. He's had multiple surgeries, and within 2 years, he had 2 surgeries and literally could not basically do the thing he loved to do, which was actually cath. So these are real people, but these are older people, right? I mean, these people like trained when lead was super heavy and everything else. Well, I'm here to tell you that I'm a pretty active guy. That's me running a half marathon. That's me skiing. And it happened to me. I was really happy. I was doing well with everything going on. And this happened to me in my late 40s, early 50s. And it happens to people when they're younger, too. Has anybody here had an orthopedic injury to their spine yet? Raise your hand if you have. So 1, 2, 3, but look at the panel. Look at the panel here. So this stuff happens. This is my MRI. Now, I didn't remember how to read MRIs, but this is let me show you the left image in the circle is all of these spinal roots in the canal. The right image is my herniated disc, where it's basically complete, you can't see where the roots ought to be. Now, I can't say this was lead. I can't say this was in the cath lab, because actually I hit a crushing forehand when it happened, and my son looked at me and was like, "You hurt your back." And I was like, "No, let's keep playing," and I literally couldn't play. So that was the first time it happened. And what I did is I said, okay, this is legit, it's real. Maybe the lead had something to do with this, so I'm gonna get Rampart, I'm not gonna wear lead. And I was super happy. So that's me, I'm Indian. I'm dancing. I'm back to doing the things I wanna do because I had a microdiscectomy and I feel much better again. So there are things that you can do, and I did my stretches, and this is the stretch study. The stretch study was in 196 people at the Mayo, and they basically had them do these exercises just, during the cath lab days. It's published, it's in JSky, and they had less disability reported. It was mildly different, but not a lot, but yet it helped. So every single one of you needs to have a stretching routine that you do, not just in your lab days, but every single day of your life, because you have a clear occupational hazard when you're working in the cath lab. So I did those things, I was feeling pretty good, but I'm gonna show you on a personal level what really happens in life. I did my stretches, I went back to doing some of the things I did, and this is my weight trend. So I have a scale at home, it does a Bluetooth thing, and I can track what my weight is like. And I think what you see here is my weight had started going up as you sort of turn 40 and early 50s, and here's my back surgery. So I have a pretty big impetus to get in shape. So my weight goes down. But what happened when I was pre-op for the back surgery is at the same time, because you get older, you need progressive glasses, and I can't get used to my progressive glasses because I keep having headaches. And I tell the ophthalmologist, I'm like, I can't do this. And she goes, there's about 1% of people in the world who can't get used to progressives. So you're either that 1% or you're gonna get used to it. So there's something else going on, and what was going on, in fact, was that during my pre-op appointment, because I hadn't seen a doctor in forever, my blood pressure was noted to be 150 over 110. And my A1C was 5.8, and my LDL was 159. So there's something going on, because I couldn't work out because of my back injury. What I'm gonna do is I'm gonna have my surgery, I'm gonna go exercise, and this is all gonna get better, right? Well, unfortunately, despite the weight loss, blood pressure meds, which I started, which then, by the way, I could totally see with my progressives. The headaches were because of the blood pressure. LDL is 181, and the A1C was 5.7. I was like, damn, I gotta start something. I gotta start a statin. I'm Indian, obviously, and so this is a problem. So I start the statin, and you see, though, despite doing that, my LDL goes to 55. Over time, even though I'm working out, et cetera, my weight kind of goes up again. And then I go skiing, and I herniate another disc. Was this because of lead? No, I was skiing, and I fell off this cliff thing, and I hurt my back. But did the lead contribute in some way? Of course it probably did. And now I have my second back surgery. I was so in pain that I literally could not walk. At the last fellows course, I could not walk from here to the other building without stopping 3 times in between. Literally, this was a year ago. So I have my back surgery, but look what happens to my weight. This time I don't lose the weight. And I'm working out again, and I'm doing what I want to do, but this stuff is going up. So why is this? Because we have continuous stress on our backs and spine throughout whatever it is we do. I'm on my phone a lot. If you look at the picture on the right, there's a 440% increase in load on your spine just from standing in this position with the phone all the time. And if you're not preventing it by doing stretches and being active and doing all those other things, besides that, I showed you what happens in the lab too. But ignorance was bliss, so I go back and I do my stuff, and I was a little bit scared to go skiing, but then I did it great, and I was talking to Margaret about it. I actually couldn't play the guitar really well because of my spine. Once that was fixed, I could go back and play the spine. That's with my wife. We're at our hospital's talent show, and I'm still eating all the normal stuff I was eating. This is when we went to Madrid. I've got a pastry, it's delicious, cappuccino, it's all great and everything, except I knew something was up because my weight had continued to go up, and so this is my hemoglobin A1C as of 2 months ago, 6.9. Now, I kind of knew. I was Indian. I have parents who were diabetic, and I, you knew that this was coming. But when you see that number staring you in the face, it's a completely different ballgame. And it's not the statin, right? Because my weight had basically continued to go up and it was a problem. So there's a drastic change that's been instituted right there. And I'm going to tell you, this is not GLP-1. Because everybody at a cardiology conference sees a cardiologist, they lost a lot of weight. Hey, you're on the stuff. We know it, and it's all fine, right? No, this is not GLP-1. This was basically, I went to India for a trip, and I did not eat naan, paratha, roti, idli, dosa, uttapam, anything like that. Now, you said, how do I eat? Well, I basically ate with a fork, the curries, and it was delicious, and it was fine. So I just completely, really reduced the carbs. And so it's basically 20 pounds in 2 months. But the real question is this going to last? Because it's not just about the back, it's not just about all these things, it's about your health. And none of us pay attention to our health. There's going to be a poll question in a second that asks that question. But we don't care about that stuff because it's so cool being an interventional cardiologist and saving patients and making money and doing on the vacations we go on that we don't think about ourselves. So the moral of the story is that I do think we really have a great job. That's still true. But we really need to take care of ourselves because the job itself, we ourselves are inherently dangerous to ourselves. Now that picture of Thor I showed you, I'd love to be Chris Hemsworth, first of all, but that picture of Thor I showed you, the clip, if you remember from the movie, is actually a little bit longer than the part where he said, because that's what heroes do. So let me show you the clip.
I choose to run toward my problems and not away from them. That's what because that's what heroes do.
So look at her face. So that's what my wife would say if she saw me giving this talk, frankly. But the point is we can be our own worst enemies. And so there's basic things that we need to do. So I've made a checklist that I want you to at least think about. Number one, core exercises and stretching need to be a daily routine from here on out. Period, end of story. There is no question that you need to do this. Number two, make a doctor's appointment. I don't care how many of you know what your LP(a) is because you did it at the ACC or the AHA, okay? Make a doctor's appointment. Look for radiation protection in your program and next job. There are actually places that are now advertising that they have radiation protection systems, whether it's Rampart, Protego, Eggs Nest, whatever it is. Look for that in your next job because you're going to be doing this for a long time. And for any of you who think it's awesome to do a 5-day-a-week cath lab job because that's all you want to do and you don't want to see clinic patients, yeah, that's great until your back completely gives out. So even with radiation protection, you still need to do these things, and I would look for it, I would ask for it, and see what happens, particularly for those of you who are looking at jobs where you're employees of a hospital, because the hospitals are sort of getting into this. I talked about physical health, I talked about exercise, but I also want to talk a little bit about mental wellness and meditation. Margaret will talk to you a little bit about this. It's just as important, and starting earlier in your life pays dividends later, just like primordial prevention of plaque and cholesterol. If you get used to meditating now, it's much easier to do when you have your midlife crisis, as opposed to when you have your midlife crisis and then you have to be like, what the hell is this meditation stuff, right? So do it early. And finally, do the things you enjoy and relish the opportunities you have to do them, because you never know. The road is often bumpier than you expect. It certainly happened to me. For me, these physical things I do, like running and skiing and all these things, are really important. And I just thought they would always be a part of my life, and there were periods of time, as I said, I could not walk from here to the other conference room at the last fellows course. So just please listen to me. This is not BS, it's very personal. It's not just me. You saw how many people raised their hands, and take note of it, because once you start as a habit early, it'll have dividends later in the end. So let's go to the two poll questions. So first, do you exercise regularly? So the first is yes, and I feel it's enough. Yes, but it's not enough. No, but I wish I could. No. So we'll wait for folks to fill it in, and then we can maybe show it later. But I mean, it's kind of what you'd expect. About 20% say yes, and I feel this is enough. And so it's important. And I would say while you're here at this course, think about your day. Like, did you plan your exercise today? Did you plan your exercise tomorrow? You're gonna have 4 great days of fun. How are you gonna sort out the exercise in between that as well? The gym is not open 24 hours. I figured that out last night. So, make sure you know what's going on. Sorry, and the last slide is one other question. And this is, if you go to the next one, how many of you have seen a doctor recently? So, do I have to do something? On the mouse, okay, thank you. Okay, oh, so you already were starting to answer. Have you seen a physician for yourself in the past 12 months? Besides the people, there's like 1,800 physicians in the room, but like a doctor. And most have said no. Sorry, I meant like somebody who's looking into your health. Half say no, and then, some with acute care, almost 10%. So fix that. Really fix it. Of course, when I go to see an internal medicine doctor and he's telling me about cholesterol and diabetes, I know what I'm talking about when I talk to him. But the effort of having to go there made me check my labs and triggered the massive diet change. So just that thing is a psychologically important thing. So thanks so much for listening. I'm happy to take any questions.
Ajay, what a fantastic presentation. I think it also requires a lot of courage, I think, to share your personal story and your narrative. I think it also illustrates, what a lot of us feel. When we're young, we feel invincible. I can deal with this tomorrow. I have my career, I have my family, I have so many things going on. I'm going to do that today and I'll put it off till tomorrow. And I think you've made the point many times that the time is now and you have to develop the habits, but also this sort of reflex almost that this is part of your life. It's part of your core, literally and figuratively.
Can I just say one funny thing? So when I was putting this talk together, I didn't know what it was going to be like. So my daughter's 23, and I FaceTimed her and I showed her the slides. And the reason I showed her the slides is I thought she would really like that Thor clip. And I was like, this is pretty cool. And instead, she goes to me, she goes, "Ooh, you're being vulnerable." So there you go.
It is absolutely. Yeah, go ahead.
Yeah, so I'm from a little different generation, effectively the first generation of interventional cardiologists. And we had none of this that Ajay talked about. The leads were primitive, there was no radiation protection. Procedures were intolerably long just for a simple coronary intervention. And some of us had drilled into our heads that you should never spend your entire life doing this. Now, nobody ever told us what comes next, but for some of us, there is life after interventional cardiology. I was fortunate. I joined CRF in 1991 when I stopped doing what was high volume PCI at that time, and I focused on imaging. Yes, I'm in the cath lab occasionally, but it's nothing compared to what it was before. So there are other opportunities and other possibilities that are not linked to the wear and tear of interventional cardiology.
Thanks for sharing that.
I'm just going to add to Ajay's warning with another personal story. So 3 years into being an attending, I was really fit, doing triathlon and all that. I get up one morning to have a shower and I fall out of bed. And I had loss of power in my left leg and kind of paresthesia in my left leg and foot drop. I was like, what on earth is going on? And of course, being the completely crazy cardiologist that we are, I had the shower, got dressed, and thankfully I was doing rounds in a hospital close enough to walk to work that day. So I dragged myself to work, dragging my left leg with a high stepping gait, the whole thing. And I got to the rounds, and the senior nurse said to me, "What's wrong with your leg?" And I said, "Yeah, I'm not quite sure. It's not really working properly." But it's such a busy day. I was like, I don't have time for this, right? So they sent me to the emergency back clinic. So I had a small prolapse in my disc and also had ruptured my piriformis from the combination of the lab and over-exercise. But I had been doing like 500-600 cases a year for that first 3 years in practice. And I then went into 6 months, I couldn't drive. I couldn't sit, I had to stand or lie flat. It was awful. I was almost like like getting depressed because I couldn't exercise, couldn't do anything I wanted to do, I had to walk everywhere. Anyway, 6 months after physiotherapy and everything, it got better, just through Pilates and physio and yoga. But since then, I now am terrified if I don't make a yoga or Pilates class at least once a week. And since then, I've never had another issue with my back. So please listen to what Ajay said.
I think it's very easy, as you're articulating, to live in denial. There's even something happening, and you'll say, I'll deal with this later, and I just have a busy day. But the day becomes a week, the week becomes a month, and then you're still dealing with it. So identifying it and intervening is really important. Ryan, were you going to make a comment?
I just came back. I shattered my elbow about a year and a half ago or so, and it's a heck of a recovery as an interventionalist. Yes. That was a rough.
Taking up to 30 atmospheres.
I will get through it one way or another. But it is a matter of really respecting your body and appreciating what you get to do in the lab and taking care of yourself outside of the lab.
Awesome. Well, thanks, everybody. And so we're going to move on to Margaret's talk, which is, I think, going to be super cool. She's going to talk a little bit about visualization and, the mental fortitude it takes to do some of these tough cases.